Wilson Phillips purchased the practice in 1996 and has since expanded to 3 locations.
There was 1 location at that time here in Clarkston. We have since expanded it to additional 2 locations, the 2nd location being in Smyrna, Georgia, and the 3rd is out in Lithonia.
We have approximately 20,000 patients, and the socioeconomic background is very diverse between African Americans, Hispanic, Caucasians, and in the Clarkston location we have an international population.
We originally started on electronic medical records in 1999-2000. At that point, we were probably one of the pioneers in that area as a pediatric practice to take on a venture of doing both electronic claims and electronic medical records.
We were paper, all paper, prior to going to our first EMR. The adjustment was just learning how to not rely on paper, that everything was computerized, everything was in the system, and there was no need to actually hold on to paper. You scan things in the system, actually destroy it because everything is in the system. There's no need to have a paper trail.
We all know that with paper medical records, transcription of individuals' writing can be misinterpreted. This system has allowed us for legibility, for ease of access. With the present system that we use, if we've done a complete physical exam on a patient that basically hasn't changed with the subsequent visit, this is a simple click of a button.
They began their journey of implementing a new system in 2010 after 10 years on a system that eventually failed to meet their evolving needs. As their technical needs changed, Dr. Willingham and Dr. Wilson Phillips realized that they needed to be able to e-prescribe and offer parents the ability to communicate about their children's health using a secure web portal.
Prior to this most recent system, we had been on EncounterPro Technologies, or JMJ, and we had been on that system for approximately 10 years. We decided to make this shift because that system did not allow us to electronically prescribe as well as have the patient communication secure access portal as well. So we felt that those were 2 components that were not originally in our EHR, and we felt very strongly that we needed to add those 2 components. I believe that they had a lot of expertise or knowledge in the process itself, so it really gave us a guideline as far as what things we needed to do. The documents are so voluminous that it's very difficult in a very busy medical practice to be able to sit down and read through all the steps that are required for us to do. So they streamlined the process for us and made it very easy for us to be able to follow the guidelines and make sure that we were meeting the timeline requirement.
They realized these were changes that had to be made to meet the requirements of meaningful use. At the heart of these changes was the need to reduce errors and improve the quality of care.
With the new system, less mistakes can be made as far as filing insurances and knowing if you have the right child with you in the room.
Meaningful use is a huge component that has allowed the pediatric and medical field to expand and be more complete, more cost efficient, where we're not duplicating services.
Dr. Willingham and Dr. Wilson Phillips developed an inter-office competition to inspire a greater understanding of the new system, rewarding their best performers with gifts. This was also done to ease the overall implementation for the entire staff.
I would say our most recent implementation went very smoothly. We were able to adapt to the new clinical system. It's very user-friendly, and we felt very comfortable using the system within approximately 30 to 45 days.
Everything is on one page. We're not having to toddle between different tabs in order to get to the information that is needed for that particular visit.
Patients love the new Athena system, the new EMR that we have. They can actually conversate with the office through the portal, through the web portal. They don't have to wait and call the office for everything. They can just put a question in through the system and we can answer it back via the system.
As we continue to learn more about the system, there are quite a few features that are very user-friendly for physicians to implement, as well as making sure that we have high compliance with following up. Our system can text our patients, they can email our patients, and leave messages.
But with all they did, much of it wouldn't be possible without the involvement and guidance of GA-HITREC.
So the RAC helped us as far as getting our paperwork together to make sure that we are ready to be able to demonstrate that our EHR is of meaningful use and is certified. So they've been very valuable in that process, and they have worked intimately with our practice administrator as far as making sure that we have had all of the steps filled out in the appropriate timeline to make sure that we meet the appropriate measures.
EMR is actually the best thing that you can do. It will actually change your life. It's less time that you'll actually have to spend here at the office.
I would tell physicians that it is very beneficial to make sure that you invest in an EHR. It really increases your bottom line.
You don't believe it until you actually see it, because it's a large dollar amount that you're investing.
There's not a lag time in payments. We can get the money within a week as opposed to 3-4 weeks.
The accuracy with your billing, it all improves.
The quality of care that you're able to deliver to your patients very well outweigh any downside to the learning curve that you may experience.